The fluorescent lights of St. Mary's Hospital hummed like trapped wasps, casting a sterile glow over the AR. Sarah Chen moved through the chaos with the precision of a surgeon and the grace of a dancer. Her scrubs, once crisp white, now bore faint stains of coffee and adrenaline badges of honor from 12-hour shifts. At 34, she'd been a nurse for a decade. Her hands a roadmap of 4 starts, wound dressings, and the quiet comfort she'd offered to hundreds of dying patients. But tonight, as she clocked out at 3 a.m., her shoulders sagged under a weight no stethoscope could measure. In the locker room, Sarah peeled off her sweat-soaked uniform. The mirror reflected a stranger. Dark circles like bruises under her eyes, a new gray strand threading her black ponytail, a mouth permanently downturned. She touched her reflection, tracing the exhaustion etched into her skin. "You save lives," she whispered. "But who's saving yours?" Outside, the Chicago wind bit through her thin coat. Her phone buzzed her. Reminder from her student loan app. $142,000 remaining. She'd graduated nursing school drowning in debt, lured by promises of recession-proof careers. Now, inflation had devoured her raises. Her $85,000 salary vanished before it hit her bank account. $2,200 a month for a studio apartment. $1,500 for loan payments. $800 for healthcare premiums, ironically. $400 for gas to commute to her second job at a nursing home. At home, she collapsed onto her futon, too tired to eat. On her nightstand lay a notice from St. Mary's. Budget cuts, mandatory overtime, no bonuses. Tears burned, but she was too dehydrated to cry. She thought of Mr. Henderson in room 402, dying alone because his family couldn't afford to visit. Avnar's Hita, collapsing mid-shift from untreated hypertension. Of her own dreams deferred a small clinic. Travel, maybe a child, all buried under medical bills and systemic neglect. The breaking point. 2 weeks later, Sarah's world fractured. She just stabilized a coding patient when Dr. Evans, the hospital administrator, called her into his office. Outside, protesters chanted, "Safe staffing saves lives." "Sarah!" "Sit," Evans said, avoiding her eyes. "We're downsizing. Your position's eliminated." She froze. "But I'm Employee of the Year. I train new nurses." "Corporate's decision." He shuffled papers. "We're replacing RNS with travel nurses. Cheaper." She left his office in a daze. In the break room, Rita pressed a thermos of coffee into her hands. "They're bleeding us dry, hon. Profit over patience." Sarah stared at the protest signs. Safe staffing saves lives. But who saved the staff? That night, she opened her laptop and Googled nurses quitting healthcare. The results were staggering. 37% of nurses plan to leave their jobs by 2027. Burnout, low pay, moral injury. She clicked on a forum post. "I make $35 an hour. The hospital bills $500 an hour for my work. Where's the justice?" Justice. The word echoed. Sarah thought of Mr. Henderson's family bankrupted by his bills, of Rita skipping her own meds to pay rent, of herself drowning in debt while shareholders profited from her labor. The spark. Sarah spent her severance pay on a ticket to a nursing conference in Denver. There, amidst lectures on empathy and resilience, she met Dr. Maya Rodriguez, a nurse-turned-entrepreneur. Maya ran holistic health solutions, consulting for corporations on employee wellness. "Healthcare's broken," Maya said over coffee. "But nurses, we hold the pieces. We see the gaps nobody else does." She showed Sarah her business plan. Preventative care reduces corporate healthcare costs by 25%. Nurses are the key. Sarah's mind raced. She'd spent years bandaging symptoms, never addressing causes. What if she could? Back in Chicago, she devoured books on health economics, business models, and social entrepreneurship. She learned that U.S. corporations lost $575 billion annually to employee burnout and absenteeism, that 80% of chronic diseases were preventable, that nurses were the most trusted professionals in America, yet least consulted in policy. One rainy Tuesday, sketching ideas at a Panarin, she had a revelation. Nurses weren't just caregivers. They were untapped capital. Their expertise in prevention, education, and human connection could revolutionize workplace wellness. The leap. Sarah emptied her savings $12,000, maxed out her last credit card, and rented a tiny co-working space. She named her venture NurseWise Solutions. Her mission: empowering nurses to heal systems, not just patients. Her first client, a local manufacturing plant. Workers there had high diabetes rates and low morale. Sarah proposed weekly on-site nurse consultations, blood pressure checks, nutrition counseling, mental health workshops, stress management, resilience training, ergonomic assessments, reducing workplace injuries. The plant manager scoffed. "We've got an insurance plan for that." Sarah leaned forward. "Your plan paid $2.3 million in claims last year. My program costs $180,000. Projected savings: $600,000 in reduced premiums, $300,000 in productivity, plus you keep skilled workers." High sign. Building the blueprint. Sarah worked 18-hour days. By day, she ran NurseWise. By night, she picked up shifts at a detox center to pay rent. She recruited 2 burned-out nurses: Rita, now her clinical director, and Ben, a tech-savvy, a nurse who built their app. Their model was radical: nurses as consultants. Corporations paid NurseWise to embed nurses in workplaces, not just treat illnesses. Prevention over pills. Focus on lifestyle changes, not prescriptions. Profit sharing. Nurses earned 40% of revenue from their programs. 6 months in, they landed a tech giant. Sarah presented data. Your employees average 12 sick days. Year of pilot group 3. Mental health claims down 60%. ROI 320%. The CEO wrote a check on the spot. Distormi. Success spread. Enemies. A rival wellness company sued NurseWise for practicing medicine without a license. Insurance lobbyists pressured clients to drop them. Worst of all, Sarah's student loans defaulted. "I can't do this," she sobbed to Rita one night, staring at eviction notices. Rita squeezed her hand. "Remember Mrs. Alvarez? The diabetic you taught to inject insulin? She just ran a marathon. You did that. Now heal the system the same way." Siraralid. She crowdsourced legal funds from nurses nationwide. She partnered with a nonprofit advocating for nurse-led clinics. She refinanced her loans using NurseWise's revenue. The turning point came when the New York Times featured her, the nurse who's fixing American healthcare one boardroom at a time. The harvest. 1 year after launching NurseWise, Sarah stood before 500 nurses at a conference. Behind her, a screen displayed their impact. 12 corporate clients, $2.4 million in revenue. Nurse consultants earning $120,000 year, double hospital pay. $8 million saved in healthcare costs. Her voice trembled. They told us nurses are angels, code for work for pennies and be grateful. But we're not angels. We're experts, engineers of human health, and it's time we owned our worth. Afterward, a young nurse approached, eyes shining. I have $200,000 in debt. Can I join NurseWise? Sarah smiled, seeing her younger self. Start by valuing your skills. The rest follows. That night, as she walked to her new apartment, no more futon, her phone buzzed. A text from Ben. Maya Rodriguez wants to acquire us. $10 million. Sarah looked at the Chicago skyline, glittering like stardust. She thought of the weight of her stethoscope, the sleepless nights, the lives she'd touched. Money was a tool, but true wealth, it was the power to heal not just patients, but the broken systems that failed them. The Chicago skyline glittered beyond Sarah Chun's office window at NurseWise. Headquarters, a converted loft in the West Loop. 12 months after launching, the scent of fresh coffee and antiseptic hand sanitizer still clung to the air, but the space had transformed. Whiteboards covered in flowcharts and KP is replaced sterile hospital walls. A team of 15 nurse consultants buzzed around open workstations, their laptops glowing with data dashboards. Sarah, now 35, stood before a projection screen, her scrubs replaced by a tailored blazer, but her stethoscope still hung around her neck, a talisman of her roots. Last quarter, we reduced diabetic complications at Miller Manufacturing by 68%, Sarah announced, pointing to a graph. But our profit margins still razor thin. We're saving lives, but we're not building sustainable wealth. Across the table, Ben, her tech lead, frowned. Our nurses are earning 6 figures, but our operational costs are bleeding us dry. Rent, software, malpractice, insurance. Rita, now Chief Clinical Officer, interjected, and we're turning away clients. We need to scale. Sarah Nadat scaling was the next mountain. NurseWise had proven its model, but growth demanded infrastructure, capital, and systems she'd never imagined. The anatomy of scaling. Sarah spent weeks dissecting their operations. She hired Lena, a Harvard MBA with healthcare experience, as co. Together, they mapped 3 pillars for growth. Nurse Consultant Network. Instead of direct hires, they'd recruit experienced nurses as independent contractors. Nurses would undergo 200 hours of training in corporate wellness, data analytics, and business communication. In return, they'd keep 60% of clients' revenue double. What hospitals paid? Tech infrastructure. Ben's team built NurseWise OS, a platform that tracked patient outcomes, billed clients, and provided nurses with AI-driven insights. For example, alert employee ID number 4,582 shows rising blood pressure. Recommend mindfulness session. Tiered pricing. They'd offer 3 packages. Basic, on-site nurse visits, $50,000 year. Premium, basic plus mental health workshops, $150,000 year. Platinum, premium plus data analytics and executive coaching, $300,000 a year. By month 3, they'd onboarded 50 nurse consultants across 6 states. Revenue hit $1.2 million. But with growth came chaos. The first fracture. In Dallas, a nurse consultant named Marcus Miss diagnosed an employee's chest pain as anxiety. The employee suffered a heart attack at his desk. Though he survived, his family sued NurseWise for negligence. Sarah flew to Dallas, her stomach churning. In a sterile conference room, Marcus wept. "I followed the protocol," he insisted. "The platform said low risk." Sarah reviewed the case. The algorithm had flagged the employee's age 42 and stress levels, but missed his family history of heart disease. The flaw wasn't Marcus, it was the system. Back in Chicago, she called an all-hands meeting. "We got complacent," she admitted. "Tech can't replace clinical judgment. We're nurses first, entrepreneurs second." They overhauled NurseWise's, added mandatory physician oversight for high-risk cases, required nurses to document gut feelings in patient notes, implemented peer review panels for complex cases. The lawsuit settled for $250,000, a devastating blow, but Sarah turned it into a lesson. Profit without integrity is poison. The wealth paradox. As NurseWise grew, so did Sarah's personal wealth. She'd paid off her student loans, bought a condo, and maxed out her 401k. But her nurses, many were still drowning in debt. One evening, she reviewed payroll data. Her consultants earned $120,000 on average, but after taxes, malpractice insurance, and student loans, they took home $55,000. "We're just trading hospital debt for entrepreneurial debt," she realized. She called a meeting with Lena and Rita. "We need to teach nurses about money, not just how to earn it, but how to multiply it." Thus, NurseWise Wealth was born. A financial literacy program for nurses. Modules included debt destruction, strategies to crush student loans in 5 years, investing 101, index funds, real estate and side hustles, tax hacks, how to write off scrubs, travel, even home offices, legacy building, wills, trusts, and generational wealth. They partnered with a credit union offering nurses 2% APR loans for refinancing debt. Within 6 months, 200 nurses had enrolled. One nurse, Maria, paid off $80,000 in loans using the debt avalanche method. "I used to cry over bills," she told Sarah. "Now I cry looking at my investment portfolio." The corporate temptation. NurseWise's success attracted sharks. A private equity firm offered $20 million for 51% control. "We'll take you national," the CEO promised. Think NurseWise in every Fortune 500 company. Sarah was tempted. The money could solve their cash flow problems, fund R&D, and make her nurses millionaire. But Lena warned, "Pay firms slash costs. They'll replace our nurses with cheaper health coaches." Hita agreed. "Remember why we started? To empower nurses, not exploit them." Sarah declined the offer. Instead, she raised $5 million from impact investors' funds that valued social returns as much as financial ones. The terms: no layoffs, nurse profit sharing locked in, a board seat for a nurse representative, the crisis of conscience. Their biggest client, Omnitech, demanded a change. "Stop recommending expensive specialists," the HRVP ordered. "Use our in-house clinic. It's cheaper." Sarah pushed back. "Your clinic missed 3 cancer cases last year. Our nurses refer out because lives matter." Omnitech threatened to cancel their $1.2 million contract. In a tense meeting, Sarah laid out the data. "Our referrals cost you $200,000 last year, but they saved $2 million in late-stage treatments. And 12 employees are alive today because of early detection." The VP relented. But the encounter left Sarah shaken. How many compromises would she make to keep the lights on? The turning point. The answer came from an unlikely source. Mr. Henderson's daughter, the elderly patient Sarah had cared for at St. Mary's, had passed away, but his daughter, a lawyer, reached out. "My dad's last words were about you," she said. "That nurse saved my dignity." She offered to help Nurse-Wise pro bono. Together, they drafted the Nurse-Wise Covenant. "We will never compromise care for profit. We will advocate for patients, even if it costs us clients. We will share wealth equitably with our nurses." Every employee signed it. Every client received a copy. The harvest. 18 months after launching Nurse-Wise Wealth, Sarah stood at a podium before 300 nurses at their first annual conference. Behind her, a screen displayed their impact. $18 million in revenue, 500 nurse consultants nationwide, $50 million saved in healthcare costs. Average nurse net worth increased by 40%. But the most powerful number, 0 lawsuits since the Dallas incident. Sarah's voice rang with conviction. "They told us nurses are angels. Code for be poor and be quiet. But we're proving that compassion and capitalism aren't enemies. We're building wealth and healing the world." Afterward, a young nurse named Aisha approached. "I have $150,000 in debt," she said. "But after Nurse-Wise Wealth, I'm buying my first rental property next month." Sarah hugged her. "That's how we change the system, one financially free nurse at a time." The personal ledger. That night, Sarah sat in her condo, reviewing her own finances. Her net worth? $3.2 million. But the numbers that mattered most weren't on the balance sheet. Nurses lifted from debt. 1,200. Lives saved through early intervention. 87. Hospitals forced to raise wages. 3. After Nurse-Wise poached their staff, her phone buzzed. A text from Lena. Omnitech just signed a 5-year, $10 million contract. They want us to expand to Europe. Sarah smiled. Scaling wasn't just about revenue. It was about rewriting the rules for nurses, for patients, for herself. As she gazed at the Chicago lights, she thought of Mr. Henderson, of Marcos in Dallas, of Aisha's rental property. The stethoscope around her neck felt lighter now. It wasn't a weight. It was a key to unlocking wealth, not just for herself, but for every nurse who'd ever been told, "Your care is invaluable, but your time isn't." The roar of a Boeing 777 engines vibrated through Sarah Chun's bones as she touched down in Zurich. Outside the window, the Swiss Alps pierced the sky like jagged teeth. Nurse-Wise was going global, and Sarah, now 37, was its reluctant ambassador. In the past 2 years, her company had reshaped American corporate wellness, but Europe, that was uncharted territory. At her hotel, a package awaited. A custom stethoscope engraved with the Nurse-Wise logo and the words "Heal Systems, not just symptoms." She smiled, remembering Rita's joke. "You're the Florence Nightingale of capitalism." But Florence never faced EU data privacy laws, or German labor unions, or French bureaucrats who viewed American healthcare with suspicion. Chapter 1. The European Gauntlet. The Geneva Summit. Sarah's first stop was the World Health Organization headquarters. She'd been invited to present Nurse-Wise's model to global health leaders. In a sterile conference room, she faced skeptical faces. "Your nurse consultants sound like a luxury for rich corporations," scoffed Dr. Klaus Weber, a German health economist. "In Europe, We have universal health care. Why would companies pay extra? Sarah leaned forward. Because universal systems are overwhelmed. In Germany, wait times for specialists averaged 4.2 weeks. Our corporate clients, 48 hours. We catch problems before they become crises. Asterisk. She clicked to a slide. NurseWise Germany pilot. 30% reduction in hospital admissions among Siemens employees. Weber raised an eyebrow. At what cost to your nurses? Sarah's voice hardened. Our German consultants earn 95,000 euros a year to 40% more than hospital nurses, with 32-hour work weeks. Murmurs rippled through the room. The Paris paradox. Next, Paris. NurseWise's first European client was but French labor laws required nurses to be employees, not contractors. Sarah's model depended on flexibility. In a tense meeting with Elsa Jar director, Sarah argued, "Our nurses thrive on autonomy. Bureaucracy kills innovation." Asterisk. The director shrugged. "In France, we protect workers even from themselves." Asterisk. Sarah spent weeks redesigning the model. NurseWise would hire French nurses directly, but with profit sharing and flexible scheduling. The compromise cost $500,000 in legal fees. The London breakthrough. London brought redemption. The NHS was in crisis: nurse shortages, burnout, strikes. Sarah met with Health Secretary James Thorne, a former surgeon. "Your nurses are fleeing to Australia," Sarah said bluntly. "We can keep them here." Asterisk. She proposed. NurseWise would partner with the NHS to place wellness nurses in corporations. Revenue would fund NHS raises. Thorne was intrigued. "Prove it." Asterisk. Sarah launched a pilot with Barclays Bank. Within 6 months, nurse consultants reduced employee sick days by 45%. Barclays donated £2 million to NHS nurse training. 3 NHS nurses joined NurseWise, earning tripled their previous salary. The headline in The Guardian: "American Nurse Saves NHS with Capitalism." Chapter 2: The Political Battlefield. The Washington Gamble. Back in the US, Sarah faced a new threat. The American Hospital Association. They'd launched a smear campaign. NurseWise puts profits over patients. Worse, a bipartisan bill threatened to classify nurse consultants as medical practitioners, requiring expensive licenses and oversight. Sarah flew to D.C. in a Senate hearing. She testified, "For decades, hospitals have charged $500 for a $35 nurse visit. We charge $150 and keep $90 for the nurse. Who's exploiting whom?" The AHS lawyer sneered. "You're a disruptor, Ms. Chun. Disruption destroys lives." Asterisk. Sarah's response went viral. "No, sir. Neglect destroys lives. We disrupt neglect." The nurse lobby. Sarah mobilized her 500 consultants. They descended on Capitol Hill not with protest signs, but with data. 1.2 million patient interactions, $200 million saved in healthcare costs, 0 malpractice suits. Senator Maria Vargas, former UNERS, became their champion. She introduced the Nurse Empowerment Act, recognizes nurse consultants as distinct from medical practitioners, creates federal grants for nurse-led wellness programs, mandates Medicare reimbursement for preventative nurse visits. The AHA fought back. They hired lobbyists, ran attack ads. Sarah countered with a documentary, The Stethoscope in the Suit, following nurse-wise nurses transforming workplaces to midnight vote. On the eve of the vote, Sarah received a threat: drop the bill or your nurses get accidents. She reported it to the FBI but didn't back down. At 2 a.m., the bill passed 52 to 48. Vargas hugged Sarah. You just changed healthcare forever. Chapter 3. The Billionaire's Dilemma. The Valuation Earthquake. With the bill passed, investors came calling. A Wall Street firm valued NurseWise at $1.2 billion. Sarah's 30% stake made her worth $360 million on paper. But wealth brought paranoia. She hired bodyguards after the DC threat, moved her family to a gated community. Stopped taking the train. Rita noticed the change. You used to ride the L with us, she said. Now you're in armored SUVs. Asterisk. Sarah sighed. I have 2,000 employees depending on me. Asterisk. The Switzerland ultimatum. NurseWise's European expansion hit a wall. Swiss regulators demanded nurses must speak 4 languages. Malpractice insurance. 500. Year mandato. Residency permits. The cost 20 million to enter a market of 8 million people. Ben argued, it's not worth it. Focus on Asia. Asterisk. Lena disagreed. Switzerland is the gateway to the EU. Asterisk. Sarah compromised. They'd launch a digital-only platform, AI-driven wellness coaching with Swiss nurses. Overseen remotely. Cost 5 million. The personal toll. Success extracted its price. Sarah's husband, David, an architect, felt like a single parent. Our daughter asked if you're married to NurseWise, he told her. Sarah missed her daughter's soccer game again. That night, she found a drawing on the fridge. A stick figure mom labeled busy, and a stick figure dad labeled sad. She wept. For the first time, she considered selling. Chapter 4. The Wealth Revolution. The NurseWise Foundation. Sarah channeled her guilt into purpose. She launched the NurseWise Foundation with $50 million of her own money. It's mission, debt forgiveness, pay off student loans for 10,000 nurses, global clinics, nurse-led health centers in underserved areas, Policy Institute, research to reshape healthcare systems. The first clinic opened in Appalachia. Within months, diabetes rates dropped 22%, the Billionaire's Manifesto. At a Forbes conference, Sarah shocked the audience. I'm worth $400 million, but I didn't earn it. The 500 nurses who built NurseWise did. The 50,000 employees whose lives we saved did. So I'm giving 90% away, she announced. 70% to the NurseWise Foundation, 20% to employee stock options, 10% to her family. The room erupted. One investor yelled, "You're destroying shareholder value." Sarah smiled. "I'm creating human value." The global rollout. With the foundation funded, NurseWise exploded globally. India partnered with Tata to place nurses in call centers, reducing repetitive strain injuries by 60%. Brazil collaborated with Petrobras on oil rig safety fatalities down to 0. Kenya, mobile nurse clinics for factory workers' malaria cases cut in half. Each venture used local nurses, paid 3x local wages with Chapter 5. The Final Crucible. The crisis in Cairo. 6 months into the Kenya project, disaster struck. A nurse-wise nurse was kidnapped in Cairo while training local staff. The kidnappers demanded $10 million. Sarah flew to Egypt against FBI advice. In a smoky back room, she faced the warlord. "I'm Sarah Chun. I'm here for my nurse." The warlord laughed. "Your money can buy anything American." Sarah leaned forward. "I'm not here to buy her. I'm here to offer you a job," she proposed. Nurse Wise would build a clinic in his territory. Jobs, medicine, respect. In return, the nurse goes free. He stared. Why? Because, Sarah said, healing is more profitable than hurting. The nurse was released in 48 hours. The clinic opened 3 months later. The David letter. Back home, David left a note. "I love you, but I love our daughter more. I'm taking her to Oregon. Find us when you're ready to be Sarah, not the billionaire nurse." Sarah collapsed. For the first time, she considered quitting NurseWise. The boardroom coup. Seizing her vulnerability, Lena and Ben staged a coup. They argued Sarah was emotionally compromised and should step down as CEO. In a tense board meeting, Sarah fought back. "You want to cut corners? Outsourced cheaper health coaches? Then you don't understand NurseWise. We're not a company. We're a movement." She played a video. A Kenyan nurse weeping as she held a baby saved from malaria. "This is why we exist," Sarah said. "Not for profit margins." The board voted 5-4 to keep her. Lena resigned. Chapter 6. The Reckoning. The Oregon Trail. Sarah took a 3-month sabbatical. She drove to Oregon, found David and their daughter in a cabin by a lake. For weeks, she cooked, gardened, and read her daughter bedtime stories. One evening, her daughter asked, "Mommy, why do you help sick people?" Sarah thought for a moment. "Because everyone deserves to feel strong, even bad men." Sarah hugged her. "Especially bad men. They are the sickest of all." David watched, tears in his eyes. "Welcome home, Sarah." The new NurseWise. Sarah returned transformed. She restructured NurseWise. CEO, Sarah Parta, Global Operations. Ben promoted from Tech Foundation. Rita full-time. Ethics Board. Nurses elected by peers. She also launched NurseWise Family Zone sites, childcare for all employees. The $1 billion gift. On NurseWise's 5th anniversary, Sarah made her final move. She transferred 100% of her shares to an employee trust. Every nurse consultant now owned part of the company. Her net worth $0. Her legacy priceless. Epilogue. The stethoscope and the stars. 10 years later, Sarah sat on her Oregon porch, watching the sunset. David grilled salmon, their daughter. Now, this essays practiced nursing skills on a stuffed bear. The world had changed. NurseWise operated in 50 countries. 1 million nurses lifted from poverty. $50 billion saved in healthcare costs. The Nurse Empowerment Act was global law. Sarah Essie Fombazde. A text from Rita. Guess what? The Cairo warlord's son just graduates from our nurse training program. Sarah smiled. She picked up her stethoscope now. A relicant placed it around her daughter's neck. "This," she said, "is the key to changing the world." As the stars emerged, Sarah Chun knew true wealth wasn't in bank accounts. It was in the lives you heal, the systems you fix, the future you build. And sometimes it was in a quiet Oregon evening, with the scent of pine and the sound of your daughter's laughter. 20 years after NERSWISE's founding, Sarah Chun stood in the Smithsonian's Healers of Humanity exhibit. Her stethoscope now, an artifact, glowed under museum lights, a silent witness to a revolution. Beside it, a holographic timeline flickered through decades of transformation. NERSWISE, valued at $1.2 billion in 2030, global operations in 87 countries by 2035, 50 million lives impacted by 2040, and Sarah's historic transfer of 100% ownership to employees in 2045. At 57, Sarah's hair was silver, but her eyes still held the fire of that nurse who'd once collapsed on a futon, drowning in debt and despair. Today, she was here not as a billionaire, but as a witness to a movement that had reshaped healthcare from the ground up. "Mom," a voice called, cutting through the exhibit's hushed reverence. Her daughter, May, now 26, and a NERSWISE consultant approached, her own stethoscope peeking from her lab coat pocket. "The UN Secretary General is asking for you." Something about the Climate Crisis Task Force. Sarah smiled. May had inherited her mother's intensity, but David's calm, having grown up in Oregon's whispering forests rather than Chicago's steel canyons. Yet she'd chosen nursing over architecture, declaring with a grin, "The stethoscope chose me, not the other way around." In the exhibit's centerpiece, a life-sized hologram replayed Sarah's 2025 Senate testimony. "Neglect destroys lives. We disrupt neglect." A group of nursing students watched, mesmerized, one whispering, "She's the reason I can afford nursing school without drowning in loans." Sarah's phone buzzed with a news alert. NERSWISE stock hits $500. Share employee trust, now worth $28 billion. She felt no thrill, only quiet pride. The employees were always had been, always would be. The year 2046 brought chaos as climate disasters overwhelmed healthcare systems worldwide. In Miami, a Category 6 hurricane submerged hospitals, turning ERs into drowning chambers. In Mumbai, monsoons transformed streets into rivers, spreading dengue and cholera. NERSWISE's clinics were on the front lines but stretched thin, resources evaporating like rain on hot pavement. Sarah convened an emergency summit at NERSWISE's Geneva headquarters, holograms of global leaders flickering around the table like ghosts of crises past and future. "We need to scale faster," argued Ben, now global CEO, his voice tight with urgency. AI triage bots, drone-delivered meds, predictive algorithms. "Robots can't hold a dying patient's hand," Rita countered, her voice steady as bedrock. She ran the foundation now, a $10 billion powerhouse funding everything from debt forgiveness to disaster response. May, leaning forward with the intensity of youth, spoke up. "What if we combine tech and touch, train nurses to operate drones and comfort the grieving, use algorithms to identify who needs human intervention most?" The room fell silent. Sarah saw it then. May wasn't just her daughter, she was the future, fearless, innovative, unburdened by the battles Sarah had already fought. May led a pilot in Kenya's drought zones, where villages withered under relentless sun and children's bellies swelled with hunger. The experiment was audacious. Drone clinics, delivering vaccines and antivirals to remote settlements unreachable by roads. Nurse navigators, local women trained in basic care, connected via hologram to specialists continents away. Crisis cryptocurrency called Metacoin, earned by community health workers for each vaccination administered or well-dug, exchangeable for food, medicine, or school fees. Results were staggering. Malaria deaths down 70% in 6 months. Malnutrition cases halved. But when a drone malfunctioned in a sandstorm, crashing into a schoolyard and killing a child, critics erupted, calling it playing God with human lives. Sarah flew to Nairobi immediately, finding May in a makeshift clinic, weeping over the small, broken body. "I failed," May whispered, her voice cracking. "I thought we could outsmart death with wires and code." Sarah held her daughter, the scent of dust and grief thick in the air. "You tried," she murmured. "You reached across oceans to save strangers. That's more than most dare to do. Failure isn't the opposite of success. Here it's part of the process." Wealth had become Sarah's cage, gilded but isolating. She couldn't buy groceries without paparazzi swarming like vultures, couldn't visit a nurse-wise clinic without disrupting operations, turning healing into spectacle. Her solution was radical invisibility. She resigned from all boards, deleted social media, and vanished from public view, moving to a floating research lab in the Pacific, the Nightingale studying ocean-borne pathogens in the crushing silence of the deep sea. There, surrounded by endless blue and the rhythmic pulse of waves, she found peace until the call came. David, her anchor, her rock, the architect who'd built their Oregon cabin with his own hands, was dying. Pancreatic cancer. The diagnosis was a death sentence. In Oregon, under the ancient oaks, where they'd scattered David's father's ashes years ago, Sarah sat by his bed, his hand frail in hers. "I should have been here," she choked, guilt of physical weight in her chest, chasing storms and pandemics while Davy squeezed her hand, his eyes clear despite the pain. "You were saving the world, Sarah Chun. I watched you do it. I was proud every single day." He died at dawn, the first rays of sun painting his face gold. Sarah scattered his ashes in the forest, where they'd rebuilt their marriage after the darkest years, his ashes mingling with the soil that nurtured the trees he'd loved. His will revealed a bombshell. He'd quietly invested $50 million in Nurse Wise's early days, believing in her when even she doubted. His stake, now worth $2.8 billion, all left to Sarah. She was a billionaire again, and she hated every digit of it. At 60, Sarah launched her final, most audacious mission. Project Immunity. The goal was staggering: eradicate preventable diseases by 2060. The plan was even more so: a global vaccine network, using NurseWise's drone fleets to deliver mRNA vaccines to the planet's most remote corners. Clean Water Co., deploying engineers and nurses to build filtration systems in drought-ravaged regions. Debt eradication, a massive initiative to buy and forgive $100 billion in crushing medical debt worldwide. The cost, $200 billion. Her net worth, $3.1 billion. She went on a relentless fundraising tour, confronting billionaires in their gilded enclaves. In Davos, she stood before a sea of tailored suits and cold eyes. "You hoard wealth like dragons sitting on mountains of gold," she declared, her voice echoing in the cavernous hall. "We're drowning in problems that money could solve. Diseases that cost pennies to prevent, lives that cost nothing to value." Responses ranged from ridicule to reverence. Warren Buffett wrote a check for $5 billion without hesitation. Elon Musk mocked her on Twitter. Nurse wants to play God with other people's money. Cute, stick to bandages. Then came the pandemic. The 2048 avian flu plague swept the globe like wildfire, mutating faster than science could track. Hospitals collapsed under the weight of the dying. NurseWise's drone network became humanity's fragile lifeline, delivering antivirals and oxygen to cities choked by the virus. But when Sarah diverted critical resources to rural Appalachia, her very first clinic had opened in a converted gas station, saving generations from coal mining disease. Critics howled. Favoritism, they screamed. Elitism, sacrificing cities for sentiment. May, now running global crisis response, pleaded over a crackling hologram link. Mom, we have to prioritize the population centers. Millions are dying. Sarah's reply was quiet, unshakable. Cities have resources. May, backup generators, field hospitals, media attention. Appalachia has us, and us is all they've ever had. The decision costs NurseWise $900 million in lost contracts and government funding, but it saved 12,000 lives in the hollows and hollers where hope had long been a scarce commodity. By 2050, Sarah Chun was more than a business leader or philanthropist. She was a cultural icon. Movies, biographies, even a Broadway musical titled The Stethoscope and The Suit chronicled her journey. Children dressed as her for Halloween, tiny plastic stethoscopes around their necks. She despised it all. "I'm not a saint," she told a Time magazine reporter in her Oregon cabin, surrounded by stacks of medical journals and David's blueprints. "I'm a nurse who got lucky, who had a daughter who believed in her, friends who fought beside her. That's all." The invitation came from the Vatican audience with the Pope. In the hushed, sacred grandeur of the Sistine Chapel, he asked her the question weighing on his heart. "How do we heal a broken world, Sister Chun?" Sarah's answer surprised him. Simple yet profound. "Listen to the nurses. They hear what the priests and politicians miss: the whispered fears, the silent suffering, the quiet courage of the vulnerable. They hold the pulse of humanity in their hands." She donated $100 million on the spot to fund nurse-led hospices in war zones from Aleppo to The attack came without warning. Returning from Rome, her private jet was sabotaged, plummeting into the icy Adriatic Sea. Sarah survived, clinging to debris for 17 agonizing hours in freezing water, hypothermia stealing her strength, memories of David and May flashing like beacons. Rescuers found her delirious, murmuring over and over, "The stethoscope, find the stethoscope, ... double quotes." The world held its breath, then celebrated when she emerged frail, bruised, but defiant at a press conference weeks later. "Try harder next time," she told her unseen attackers, her voice thin but unbroken, the weight of her stethoscope heavy around her neck. At 65, Sarah faced her own mortality with the same clarity she'd brought to every crisis: early-stage Alzheimer's. The diagnosis was a death sentence for the mind that had reshaped healthcare. She gathered her inner circle on the deck of the night, the Pacific stretching endlessly around them. May, Rita, Ben, and 3 young NurseWise leaders: a nurse from Kenya who'd grown up in a slum, a Brazilian doctor who'd abandoned plastic surgery for community health, an Indian engineer who designed water purification systems using coconut husks. "My mind is fading," Sarah said calmly, the ocean breeze lifting her silver hair. "But NurseWise must endure. It must be bigger than any one of us, bigger than me." She unveiled her final act, her legacy etched in stone. The stethoscope protocol: leadership would rotate globally every 5 years, preventing stagnation and no individual could own more than 1% of NurseWise, shattering the possibility of future tycoons. And every employee, from janitor to CEO, must sign the covenant. I will heal systems, not just symptoms. I will value people over profit. I will listen before I lead. Ma objected, her voice tight with emotion. Mom, this is too restrictive. It will strangle growth, scare investors. Sarah smiled. A rare, radiant thing. Restrictions prevent greed. May. Remember the aha? The lobbyists? The lawsuits. This isn't a cage. It's armor. For the movement, for the future. Sarah spent her final years in the Oregon cabin, surrounded by towering trees and the ghosts of memories. She taught May's daughter Lily, age 8, with Sarah's dark eyes and David's dimples to use a stethoscope. Listen, Sarah whispered, pressing the cool metal disc to Lily's small chest. That's life. Rhythmic, strong, miraculous. Never take it for granted. Lily frowned, looking up at her grandmother. But Grandma, you're rich, like really rich. Why do you live in a little cabin when you could have a castle? Sarah's eyes twinkled, the fog of Alzheimer's momentarily lifting. Because wealth isn't what you own, little sparrow. It's what you set free. It's the ripples you leave in the pond when you're gone. Sarah Chun died at 87, under the ancient oak tree where David's ashes lay, the Pacific wind sighing through the branches. Her last words, whispered to May, were, "The pulse. Find the pulse." ... Quotes. The world mourned, but Nursewise thrived, a living testament to her vision. By 2100, the employee trust was worth $150 billion. Diseases like polio, malaria, and cholera were eradicated from human experience. 20 million nurses had been lifted from poverty and empowered to heal. May, now 70, and chair of the Global Nurse Council, stood before the United Nations General Assembly, a hologram of her mother smiling softly behind her. My mother taught us that true wealth flows like blood, May said, her voice clear and strong. It must circulate to give life. It must nourish every cell, every community, every corner of the world it touches. Hoard it, and it turns to poison. Share it, and it becomes immortal. She announced the Sarah Chun Century, a global initiative to train 100 million nurses by 2120, ensuring the pulse of healing would never fade. In Cedar Ridge, Ohio, where Nursewise began in a cramped co-working space above a bakery, a statue was unveiled in the town square, not of Sarah Chun, but of a nurse faceless, universal holding a stethoscope like an offering. A child, carved from local stone, reached for it, small fingers outstretched. The plaque read simply, "She healed the world by listening." As the sun set, casting long shadows across the square, a young woman placed fresh wildflowers at the statue's base. Her name tag, pinned to crisp white scrubs, gleamed in the twilight. Lily Chun, RN. The stethoscope around her neck, cool against her skin, felt less like a tool and more like a promise. Promise whispered decades ago under an Oregon oak, now echoing across continents and generations. The pulse went on.